Sometimes a doctor examines a patient and he sees a fullness in the neck and he says it might be a goiter. What is a goiter?
A goiter is an enlarged thyroid gland, and it simply means a gland that's large. Some goiters have nodules, some do not, and some goiters have normal function, normal thyroid function.
So the first approach of a doctor examining, he looks at, there's some blood tests he would draw initially?
Sure. Oftentimes thyroid levels are drawn, or a thyroid panel, and that usually involves a TSH, or thyroid stimulating hormone, and sometimes a T3 and T4 level. And these give your doctor an idea of how the thyroid gland is actually functioning.
Now, if he feels a little mass, would he do any other tests to see what the mass could be related to?
Sure. The American Thyroid Association guidelines from 2009 state that when a thyroid lump or nodule is detected, one of the first tests to perform is a thyroid function test, or TSH, as we just spoke about. The next diagnostic test oftentimes is a thyroid ultrasound, which will give your doctor a picture of what the thyroid gland looks like, the size of the nodule, and the characteristics of the nodule.
And from that test, do you know you have cancer?
The thyroid ultrasound will identify if there's a nodularity within the gland, specific nodules, multiple nodules, and then each one of those nodules needs to be evaluated to see if they are of the size criteria for biopsy. And depending on the ultrasound characteristics and the size, a determination is made by your doctor whether a biopsy is needed.
Do they ever do any isotope tests to see if there's anything there?
There are scans that are done of the thyroid gland which can tell if the gland is overfunctioning or underfunctioning, and those are used specifically if that thyroid, the TSH, the thyroid function test, shows that the gland is overfunctioning.
You can have a goiter and have normal thyroid functioning tests too, couldn't you?
That's correct. Oftentimes, a thyroid test is done, the TSH, the thyroid levels are drawn, and it's normal, but the gland can be enlarged. You can have a goiter, you can have a nodule, you can have a thyroid cancer with normal thyroid blood tests. So blood tests don't always show a problem with the thyroid gland.
So essentially you can have an overactive thyroid, underactive thyroid, or we call euthyroid, or a normal functioning thyroid from these tests?
Correct, correct. The blood test shows exactly what you just said. If you have a hypothyroidism, which is low functioning thyroid, hyperthyroidism, which is increased function, or euthyroid, which is a normal thyroid state. And again, that's what you can tell from the blood tests.